that trial, and he's been talking to me, explaining how it works.
The niche of this intervention right now is aimed at those who are at higher risk of complications, but in the community and not yet that sick that they need to go to hospital. And we're hoping to find drugs that might prevent that kind of disease progression and help them get better quicker in general practice in the community and take pressure off the secondary care services.
So just to be clear to people watching this is a treatment rather than a vaccine. And how would this particular one work?
Well, there's some early evidence that this drug, hydroxychloroquine, might prevent viral replication and attachment of the virus to the cells and getting into the cells. So it might, and it also has anti-inflammatory properties, which might play a critical role in the development of severe lung complications. So it's a well-known drug, and it may prevent the virus from getting into the cells and have generalized anti-inflammatory properties, which could be beneficial.
I think when President Trump mentioned it, he called it potentially a game changer. Would you agree with that?
Well, I think we absolutely need much better clinical evidence before we start making assertions like that. There's preliminary laboratory evidence that this drug might be useful in terms of limiting viral replication, and there are 3 studies, all of them controversial, which might or might not show an effect. It would be a huge mistake to provide this drug on a large scale without the proper evidence that it actually helps people, because there is no drug on this planet that doesn't have side effects, including hydroxychloroquine, and we shouldn't be making drugs widely available that are not proven to benefit people more than they harm people.
Do you think that somewhere out there is something that can at least alleviate the symptoms of this?
There are drugs such as paracetamol, which will help people feel better, particularly if they have mild illness. And it's worth noting that most people who get this might have mild illness, and many will be asymptomatic, actually. So, paracetamol and supportive measures will be useful for everybody. I'm sure there are specific treatments that will be developed. I'm sure we'll get a vaccine. These might be some ways off now. But a drug like hydroxychloroquine, I think that if it is going to work, most of the trials, most of the interventions have been evaluated in hospitals in people who are already quite sick. And it might be quite a heavy lift to expect something like hydroxychloroquine to be making a dramatic difference when people are already on ventilators and very sick. So getting them earlier on in the illness, particularly those at high risk, I think that's where these kind of interventions might play an important role, keeping people out of hospital. So this would be one of the first trials done in primary care for treatment in earlier stages of the disease.
Professor Christopher Butler there. Sweden has seen more than 100 deaths from coronavirus.